Remember that cute purple little hippo plushie in our Five Flavors Forest Cafe Flavy Verde lesson? Well, enough with the cute plushies. It's time to see some hippos for real, which is why we're here at the secluded Hep Sea, a body of water untouched by humankind. Except for that Five Flavors Forest Cafe takeout bag floating there, which is to help you remember that Hep C is a member of the Flaviviridae family. And if you remember back to our Flaviviridae lesson, you probably already knew that Hep C is a positive sense RNA virus. But just to really emphasize that point, we'll give the scene our usual warm colors and we'll add our positive sense sun in the background to help you remember all of this. All right, so enough with the scene setting. Let's bring in the star of our show. Here's our little hepatitis hippo with that C shaped earring to remind you that in this lesson we're going to be talking about Hep C. Now, you may think of hippos as being kind of slow and dim witted, but in reality, when they're not being watched by humans, they're actually quite bright. So you'll see our little hippo is at hippo class, and he's being taught by a wise elder hippo enveloped in a robe. That robe is to remind you that Hep C is an enveloped virus. Now, I'm not sure exactly what this young hippo is learning, but it's clearly not spelling. That sign is all messed up. And that's because one of the key virulence factors of Hep C is that its RNA dependent RNA polymerase lacks 3' to 5' exonuclease activity. Or what that means in practice is that it lacks proofreading ability. This means that it ends up developing a lot of mutations really quickly, and that allows it to constantly evade and stay ahead of your immune system. And it's also part of the reason why it's so hard to develop a vaccine for Hep C. The upshot here is that Hep C has a high degree of antigenic variation, and so we'll symbolize this by giving our enveloped elder a cool rainbow robe to symbolize that patchwork of antigens that helps Hep C evade your immune system. So that's how Hep C evades your immune system, but how do patients get it in the first place? Well, there are a bunch of different ways: vertical transmission from mother to child, sexual transmission, though it's less common than Hep B, but two of the most important are parenteral, so needle sharing or sharps injuries in healthcare workers, and blood transfusions. So we'll symbolize the needles with that little needle pen our hippo is writing with, and we'll symbolize blood transfusions with his tipped over inkwell that's spilling red ink all around him in the water there. Okay, so let's switch gears a little bit and talk about the clinical presentation of Hep C. And thankfully, one of the clues is right there in the name: hepatitis. In acute Hep C, so the first 6 months or so after Hep C exposure, you're looking for signs of liver inflammation. That might be generally elevated LFTs, but in particular, keep an eye out for fluctuating ALT. We'll symbolize that with this ALT buoy fluctuating up and down on the waves behind our young Hep C hippo. And we're specifically putting it behind our young hippo to remind you that this is a finding in acute Hep C. And then, in addition to those fluctuating ALTs, patients may present with more nonspecific complaints: jaundice, nausea, right upper quadrant pain, or low grade fever. Unfortunately, more than 50% of patients progress to chronic hepatitis C. So we'll symbolize chronic hepatitis with this older hippo snoozing on the rock here. And you'll notice that it's not any old rock, it's a specifically liver shaped rock. That's to remind you that many patients progress to liver cirrhosis, where the liver gets sort of hard and rock like. An even more concerning sequela is hepatocellular carcinoma. So we'll add our recurring cancer crabs crawling all over our chronic hepatitis hippo here to remind you of the possibility of developing HCC. If you suspect your patient might have hepatitis C, how do you go about diagnosing it? It's a little more complicated than in some other conditions, but it basically boils down to two tests. Typically, you'll first do a Hep C antibody test, and then if that's positive, you'll get a Hep C RNA PCR. So we'll symbolize those two tests with an antibody shaped tree, and then this pile of strandy orange seaweed that kind of looks like RNA. We'll have two little hippos playing in there to remind you that we're talking about Hep C RNA. And you'll notice that one of the hippos is kind of playing and cavorting, jumping around. And that's because a positive Hep C RNA basically means that the patient has Hep C. It might be acute, it might be chronic, but they have Hep C. But then there's the other hippo who's kind of hiding in the seaweed there. That's because if you have a negative antibody test, but still have a positive RNA test, that might mean you have an occult Hep C infection. So either you're still in the window period where you haven't developed those antibodies yet, but you do have the RNA floating around, or your patient might be immunocompromised, so they're not mounting that antibody response. Whatever the case, know that if you have a positive RNA test, your patient very likely has Hep C. And then just one more point here. If both tests are negative, but you're pretty sure the patient had an exposure, you'll want to recheck those results at 1, 3, and 6 months. All right, so we're almost done, but I have some good news here for you at the end. It used to be that for patients who didn't clear the virus on their own and progressed to chronic hep C, that was pretty much a death sentence. But recent developments in direct acting antivirals have made hep C actually pretty curable. So, to symbolize those direct acting antivirals, we'll have the famous director of a notable wildlife show making a documentary about these anthropomorphic hippos. Just to really hammer that point home, we'll write director on his chair, and then just for fun, we'll name him, let's call him DAA Vid Attenshire, the famous nature documentarian. In addition to treating patients with DAAs, you'll also want to make sure that they're vaccinated for Hep A and Hep B, unless they're already immune. So we'll give this production two cameras, camera A and camera B, and you'll see that they're mounted on syringe bases to help you remember that we want to vaccinate patients for Hep A and Hep B. And then the last point is if they've developed chronic Hep C and they've progressed to cirrhosis, you want to routinely check their serum AFP, alpha fetoprotein, and get liver ultrasounds to monitor for hepatocellular carcinoma. So, to remind you of that liver ultrasound, we'll have our director yelling through a megaphone, our recurring symbol for ultrasound, and then you'll see that he's got his licensed animal filming permit to remind you to check for AFP. And that's about it for Hep C. But this is a super high yield virus from its virology to its diagnosis and screening procedures to treatment. You're very likely to get asked about it on a test, so make sure you have this one down pat.